morning, Oghuzan. As we stand here on the eve or cusp of going public, I wanted to have a conversation with you and kind of do a little bit of a walk down memory lane, if that's okay with you. And I was just thinking back to that day in 2019 when you and I first spoke.
Mhm.
We got introduced by a common friend, Karthik. I think you and Karthik's wife worked together or something like that, if I'm not mistaken. And to be honest with you, when I first got that introduction, I felt a certain imposter syndrome because I was like, why does Oguzhan want to talk to me about this? Because I'm not that knowledgeable. I'm more of a generalist investor, not a healthcare investor. Uh, and I was also thinking to myself, I think we had scheduled like a half hour to speak. And I was thinking to myself, you are the last call between me and my first glass of wine. And what was supposed to be a half hour call, I think ended up being like a 1.5 hour call. And then we agreed to meet the next day for another 3, 4 hours. And after that, boy, I got, I think, a molecular diagnostics 101. and uh, and I didn't want to let you go before I told you that, look, pending the confirmatory diligence, we are in if you will have us. And then I think you said by Sunday you would like to make a decision whether you want to go with a one-handed deal or a two-handed deal. And you ended up choosing to go with Hummingbird and Neotribe, Firat and me. So I guess the imposter syndrome in me still wonders, you know, to get the view from your side as to why did you want to meet with me, and how did you identify me as a preferred investor or Neotribe as a preferred investor?
Um, it's a good question, and we did have some healthcare specialist investors that we were talking with at that time, but it was a very competitive round, as you know. But I think what we realized even back then that a lot of the healthcare specialist investors were thinking of what we are trying to build with a single asset. There at that time, at least, there were no molecular diagnostics company that were worth 20+ billion dollars. There were,
Mm,
most companies essentially sold before they even hit $1 billion, market cap or valuation. So everyone was thinking, I think, on the specialist side, essentially too small. And,
mm,
I think that is why I've always felt that the generalist investors could really cut through kind of that maybe the incorrect pattern recognition that they were doing and see what it can
think
truly
a little out of the
be.
box.
Yeah, so it's kind of like they can think out of the box. Um and the other thing that I found was that the really smart investors were a lot of the times, even though they might not know molecular diagnostics, they were asking better questions.
Mm,
They were asking questions to truly understand, what this can do, rather than trying to fit into, as in your analogy, into a box that they already have.
mm,
Um, and I realized that we would not have great alignment with an investor that would want us to, get acquired at $300 million. That wasn't the reason that, I started BillionToOne after PhD. That wasn't the goal. We had, much bigger ambitions. And I think you had, really big ambitions as well. So I thought that, that combination was perfect.
awesome. Um, I'm also reminded of the process we went through to make this decision. we speak on a Friday, talk at length on a Saturday. And I spoke to the director of Clear certification on a Sunday. And we shook hands, I think, on a Sunday or early Monday. But come Monday, I was afraid that the deal might not actually happen, if you remember, because there was this infamous investor that you and I know and who shall remain nameless who dropped a term sheet that was at a significantly higher price. And I like to tell the story not to throw dirt at someone else, but to really highlight the person you are,
Thank you.
because you had agreed to a deal with Firat and me, and you said, I'm honoring that deal, even though we hadn't even signed a term sheet or anything like that.
Mhm.
And it just is a testament to your integrity. But I'm just curious, Oghuzhan, what made you stay the course when a lot of other entrepreneurs, I'll tell you this honestly, would have gone in a different direction? And I wouldn't have blamed them for it.
I think, for me that, integrity is so important. I come from an academic background where your honesty and integrity is everything. So, there is that, like, I I think, people ask me, you know, what makes you, what keeps you awake at night? And I tell them nothing. I sleep really, really well. And the reason is that I think, if we are always making decisions that are based on first principles, and that is, true when you are operating the company, or when it is true when you are dealing with, investors and others as well, when you are principled, you sleep well because you know that based on the information that you have at that time, you made the principled decision. And in that particular case, you know, I have always, thought of essentially even, having a signed term sheet is technically not binding, right? So, my argument there was that how can I break my word and go with an investor and then trust that investor to keep their word, that they are
Mm.
not going to,
Renege on that.
break a non-binding, term sheet. So,
Mm.
from that perspective, I've always thought of this as a very small world where
Mm.
your integrity is worth so much more than, any valuation or any amount of dilution.
Thank you. Um, all I'll say is we are thrilled and delighted to be part of that journey. And I hope along the way we've added some value. Tell me, Oghuzhan, how and when did you know that billion to one would be your life's mission?
Um, I think it, it's always an ongoing journey, right? I think maybe this is the life of an entrepreneur. And, when I look at billion to one, even today, I see, 100x more that we can do. And, look at what we have done. And I see that as kind of 1x. But I think it was the realization that, I could, and we could make such a large impact in healthcare, you know, right now. So, I had a good academic career and, I felt that, broadening humanities knowledge base and information was a very worthwhile goal. And, I thought that, I would spend my life doing that and, that would be impactful. But, I was thinking, what I am working on making an incremental impact 100 years from now because it was all about basic research and understanding how cells work. And once I realized that you could actually make a really large impact in healthcare immediately, we even though I wasn't thinking of starting a company, and I certainly didn't want to manage so many people. um, it was essentially an understanding that, okay, we can really make a difference here and solve problems that no one else would solve. And I think that is the critical part, that realization that, this first generation cell-free DNA companies in a few years, changed even standard of care. but they are looking at the problems kind of in a brute force way, and that if we actually apply, mathematical, physical, statistical thinking, we can essentially make, such a huge impact on so many people's lives, like today, not 100 years from now. So that is kind of when, in the last, when I was graduating from Stanford, I spent a lot of time trying to understand, okay, what do I need to learn so that this company can be successful?
Yeah, it's rare for a company to not only be a commercial success, but also to have social impact. And I think that is the beauty of what you've done here at Billion to One.
Thank
So,
you.
for the benefit of our audience here, Oguzhan, would you mind just describing in very simple words um, Billion to One's technology?
Of course. So all of our tissues shed the fragmented cell-free DNA into the bloodstream. These are little pieces of DNA that are floating in blood. And about, a decade ago, people have realized that they can, sequence this DNA and be able to do, non-invasive diagnostics. But what we have realized is that, essentially as sequencing, gets less and less expensive, people have been doing this more widely, more deeply, but it sets a fundamental limit into, the how small of a difference that you can detect, what conditions that you can detect. And it is really due to the fact that even though this is truly a revolutionary biomarker, even though essentially cell-free DNA makes blood a microcosm of the entire body. You can understand every organ health. You can do amazing things with, both prenatal testing and, and oncology. The problem is that essentially because it is so rare, essentially all the tissues are shedding DNA and the tumor might be shedding only, 0.01% of that total cell-free DNA. You have to amplify that sample in the lab before you can sequence it. And that amplification process, just by the nature of, biological process, that it is error prone. So you start with a very small signal and you are amplifying it, which adds tremendous amount of noise, which meant that, these diagnostics were all limited by, the same fundamental limit that is set by the noise. So what
Mm,
Billion to One does is essentially recognizes that, we really need to make sure that we can remove this noise.
mm,
So we design and add synthetic DNA molecules, artificial DNA molecules that mimic the original sample.
mm,
We add them to the sample before any amplification and sequencing happens in the lab, so that at the end, we know where the errors occurred, where the amplification biases are, so that we can remove them. It's
mm,
essentially like a noise canceling headphone, right?
mm,
If you have a lot of noise that is coming through, just, trying to increase the volume doesn't really help that much because it increases the noise as well.
mm,
So that is what, other technologies do here. What we are
mm,
doing is essentially because of these synthetic molecules that we add that mimic the sample, we know where the noise is happening so that we
mm,
can remove it. So we get the pure signal. And that essentially enables us to, really bring cell-free DNA to its full potential, right? It allows us to know uh, even these very important single gene conditions like cystic fibrosis and sickle cell disease, just from a maternal blood sample, whether the baby has them. For cancer, there were applications in the late stage cancers, but we have been able to detect, so many more targeted therapies for patients. But really, eventually, this can be used to bring these diagnostics to early stage cancer detection so that the cancer can be detected before it metastasizes, before it is irreversible.
mm. Um, in my 20-year history as a VC, Oguzhan, BillionToOne is one of the very few companies that has beaten its target, set and beat its target every quarter, even during the toughest times of the pandemic.
Mhm.
From your perspective, what was your biggest challenge uh, along this way, and how did you overcome it?
I mean, there were a lot of challenges, really every quarter. If you look at, our charts, they look beautiful, right? Up and to the right,
Mm.
exponential, it looks almost as if, it was created in a classroom, not in real life.
Yeah.
Uh, but if you look at every quarter, there was a different challenge that we had to overcome. There was something that, that we had to get very creative about. But I would really highlight two things as, our biggest challenges. One was, very early on, we were really having difficulty hiring great sales reps. And, we made this big push and finally, and we had to, even use patients as a way to, get in front of physicians and create that initial momentum, which allowed us to, start getting, great sales representatives. And we had this flywheel effect where the more, when once you have great sales representatives and that are, they are doing really well, other great representatives, want to join your company. So we kind of the first 6 months after launch, we were really dealing with these problems and we felt that, okay, now we have the flywheel, everything is doing well, we can beat every target. And literally 2 months later, COVID happened
Mm.
after that. And so the COVID initial times of COVID were very difficult because if you look at other diagnostics companies, they were all flat. If
Mm.
you weren't running a COVID-19 lab, you didn't grow during that time.
Correct.
That was the only time, if you remember, I told,
Yeah.
the board, like, we are not going to hit the numbers. Like, this is just
Yeah. Yeah.
like
Yeah.
doesn't seem feasible to hit the numbers. Um,
In
but
fact, if you remember at that time, we also talked about, should we use our technology to come up with a COVID test?
yeah,
And I think we decided as a board, no, we'll just stay the course. It doesn't
yeah.
matter even if we miss our number for the quarter,
Mhm.
which you ended up not doing. You actually beat that number even during that quarter.
Yes, yes. I mean, and I really appreciate that, from you and from the board because, if we became a COVID-19 testing company, it would have really derailed our overall long-term goal.
100%.
Yes, yes, we would have made, hundreds of millions of dollars in revenue and, we would have grown very fast during that time, but it would have taken all the mind share and resources from our, actual business. So that was, I think, one of the uh, you know best things that any board can do, right? I think a lot of boards, even in public companies, panicked during that time, and even these large companies went to COVID-19 testing businesses, which really resulted in long-term structural problems for them. Yeah, and we really did not. We developed. We had a 2-person, 3-person team that developed the COVID-19 test for us to test our own employees so that we could stay functional. And then we sold it as a kit to some other labs, but we haven't gone into full-born COVID-19 testing, and that was really critical. But when COVID-19 happened, and when I said, look, it doesn't even seem feasible that we can hit our goals because no clinic was seeing sales reps. Like it was essentially impossible for a sales rep to get in front of an OBGYN. And how would you actually even grow during that time? And we had to get very creative, right? That was a time that was very, very difficult, very challenging. Every day was essentially a war room.
Mm.
But we were able to use that almost to our advantage to be able to grow because we were able to get hand sanitizers and N95 masks when US government couldn't access them.
Mm.
We were
Mm.
we were able to get them from China, and we could use that, essentially you could use them to have safe conversations with OBGYNs. We could meet them in the parking lots. We created care packages for them. Um, and that allowed us to speak with OBGYNs. And one benefit of our test is that you don't need to test the father. So that actually made, once we were able to have the conversation, that actually made our test an even bigger value proposition. And we grew more than 10x during the first year of COVID. So
It reduced the friction even for the OBGYN, right?
yes, yes. But that required, so much effort from our, team members. It was, essentially, again, it was like a war room every day. But that creativity really allowed us to maintain and really grow our test volume. And the second one, I think, was reimbursement. You remember this,
Of course.
reimbursement was so tough, so difficult. We are out of network. Once, if you are out of network, the providers, typically don't want to use your test, and payers know this, so they essentially deny your claims. They don't want to pay even for medically necessary tests. So I had to really learn reimbursement very, very deeply. And even then it took years and a lot of creativity and building really great teams eventually to be able to crack that reimbursement uh, problem. But I think everyone in our company would tell you that it was all hands on deck about reimbursement. In all hands, which we have a weekly town hall, and one department tells about what they are working on in the past few months every week, and it creates this great transparent culture where everyone is learning from each other. you know People would talk about ASP and reimbursement every single week.
Mm-hmm.
There were, people were playing, tic-tac-toe games about like, would they say reimbursement? Would they say ASP? Even on an engineering weekly call, because everyone was
So
working.
there was a laser-like focus within the
Yes.
entire company.
Entire company, engineering was like, how can we help with reimbursement? Like everyone, sales was, how can we help with reimbursement? So it was essentially all hands on deck for, really 18, 24 months for us to increase our ASPs, increase our gross margins, because that is essentially what eventually drove us to profitability.
Awesome. I'm also reminded during our journey together, 2019, which is the year we invested, by the end of that year, we were doing one test a day. 2020, I think we were averaging 10 tests a day. 2021 was 133 tests per day. We're like, all right. As you can tell, I remember these numbers pretty well. But today, we're doing several thousand tests a day, right? Over that period of time, Oguzhan, having been a CEO myself, one of the things I always used to tell myself as a CEO is this, right? That is, my title never changed, but I had to reinvent myself every year.
Mhm.
Okay. So I'm curious, how has that journey been for you? How have you found yourself reinventing yourself? Would love to hear in your own words as to how that journey has been as a
Um,
leader, as a person.
Yeah, I mean, I have always been very hands-on, but up to 100 employees, I was I was finance, I was people ops. There was not a single people ops, HR person in the entire company. I would, train the sales team, and then at night, I would uh, enter the I-9 information into the USCIS, with the deadline coming in for everyone who is getting onboarded. Of course, that meant that over time, I was hiring executives and bringing them to those positions. But great thing about that is that I have done every single one of those positions, so I could really judge who could do that job really well.
Or sometimes
So
better than you.
yeah, exactly. That is the goal, right? You
That's the
want them to
goal.
be,
You want to hire people better than you.
yeah, you want them to be better at that thing than that you are doing. So I think really for me, it was more about, what I am spending my time in. And, I try to spend my time in the most important things, at that time. So, for the first, I think, 50, 100 employees, it is really about setting the operational principles of the company, right? Making sure that you have the, right cadences, the OKRs, the performance reviews, like everything related to the culture of the company. I set it myself before kind of bringing in the external experts that can actually take it to the next level. Same thing with, other departments. And that meant that, every year I was focused on something different. Early on, it was about the culture, the operational principles, and, commercial success of the company. Later on, it was about reimbursement. And what I also find is that, you can't really attract the greatest VP, for instance, for a role when you are too early. Like even though our current VP of reimbursement is, truly excellent, probably the, best reimbursement expert in the entire country, like without exception. But I tried to hire her, 2, 3 years earlier. I could not. She wouldn't join. So, part of it is also recognizing that, until you reach a particular level of maturity, you might not be able to even hire the person that you want to hire.
Or sometimes the person who you hire during the 0 to 1, 1 to 10 phase may not be the person that takes you from 10 to
Exactly.
100 kind of thing, as we
Exactly.
found out also in
Exactly.
for various roles. So Oghuzhan, when I think back also during my journey, I have been part of several great one product companies. There are very few successful two product companies or multi product companies. BillionToOne is an exception there. That is, we've not only got a very successful non invasive prenatal testing business, we now got a very successful oncology business that is scaling pretty rapidly. So I'm curious, what has it taken for you to conceive of this two product strategy? Did you have that in mind right from the get go? And from an operational point of view, an execution point of view, what has it taken to make sure that one doesn't distract from the other?
Yeah, great question, because it is very difficult because these are in different phases of their
Correct.
growth as well.
Mhm.
Um, So if you actually look back on our, Series A tech explainer, our investor deck, it is actually laid out exactly as we have, built those products. Interestingly, at that time, the nomenclature for those products were not even set in the field. So the names are slightly different today than what we considered at that time, because we were, I think, really ahead of the field in terms of how we were thinking about it. But we realized that this technology, again, thinking from first principles, could be applied to any cell-free DNA testing. And we realized that, okay, let's go into prenatal market first, where we can create a good business, and then we can go into the larger oncology market, because we also didn't want to, maybe make the mistake that some of the, I think, founders made in this field. If you go for the largest opportunity, which is always going to be oncology, you also need to spend hundreds of millions of dollars to make it, possible. And being a first-time founder, I didn't believe that I could raise hundreds of millions of dollars and go for that opportunity, right away. It was essentially building the step by step so that we can go to prenatal market, expand in the prenatal market, use the resources, the profitability, the revenues that we have to go into late stage cancer market, where we can prove our technology very fast in that market as well, and then go into early stage cancer, and then eventually go to early detection. So if you look at it, it is essentially going to larger and larger markets that take more and more
Progressively.
resources progressively. Exactly. Um, so it worked out, I think, pretty close to how we envisioned that to happen, but it was still very difficult operationally, because our prenatal business, is in the larger scale, which means that the way to operate is different from oncology, where you want to run it as a fast-moving startup. So we created this rule where actually no one is allowed to work on both prenatal and oncology. Oncology is almost like a separate group that actually gets interviewed even when people are moving from prenatal to oncology.
It's like a
Uh,
startup within a startup.
yes, it is like a startup within a startup. And I think that worked out quite well. Our executive leadership team oversee both prenatal and oncology product lines, but they are strategic enough that they can kind of context switch. But for anyone who is not in executive leadership team, we kind of require them to work either in prenatal or oncology, because we wanted to create a different modality of operations, right? It is not, one is about robustness, scalable systems. The other one is essentially the iteration speed, learning, innovation. Um, the other thing that I think really helped us is that we created these Bell Labs R&D model that is different from many, essentially any other company that I know. So all the R&D scientists are selected through this extremely rigorous process where they have to be great as a full stack scientist. Essentially, they need to be great at wet lab. They need to be great at first principles statistics, computational biology. They need to be great at bioinformatics, and that means that less than 1 in 100 people actually can have that
Do all
span
of that.
of
Hmm.
expertise.
Hmm.
And I still run that process myself. Like, I am the hiring manager. I hire R&D scientists, myself with David, and they all report to David and me.
Hmm.
So what that means is that we don't have hierarchy. We don't have a VP of R&D and D and the managers of R&D and the scientists themselves. We essentially created almost these small pods. Each scientist has a couple of, 1 to 3 research associates, and they are given essentially a goal of launching a product. So what that means is that we have almost like actually 5+ startups within the larger company. They all
Hmm.
report directly to me, and
Hmm.
they are truly, truly remarkable scientists. And so even though it looks from outside like we have 3 or 4 products, 2 on prenatal, two in oncology, we have also been able to launch multiple versions of these products over time and really expand the scope, because we actually have almost like 5 different startups within the larger company, and each
It's
person.
like billion to one labs.
Yes, it's like BillionToOne labs. And they are amazing. And because
Hmm.
they report to David and me, they get things done lightning quick. So,
Hmm.
when it would take another company, 2, 3 years to launch something, we launch it in 6 months.
It's kind of like I call it, a little bit of structured chaos,
Hmm.
So you're
Yes.
actually encouraging some of that entropy there, right?
Hmm. Yeah.
So here, as a soon to be public company at the time of this recording, what does success look like for you? And what is your vision for the future? I've heard you say this to me, but I'd like my audience to hear it.
We want to change the standard of care. We want to, truly bring personalized medicine to a reality. We want to be able to solve really big problems, eventually, not just prenatal genetics, but prenatal epigenetics and, preterm birth, preeclampsia. In the oncology side, make such a big impact in oncology that, if you look back 10 years from now into the entire century, and we can say that this is the biggest impact that was made in oncology care. And that is possible. That is essentially within reach. And our goal in the next 5 years is to help millions of patients change standard of care both in prenatal and oncology, and become a generational company, become the first molecular diagnostics company in our space to become an S&P 500 company. And the interesting thing is that I've been saying S&P 500 as a kind of goal, as a goalpost of being a generational company, even maybe 3+ years ago. At that
Mm.
time, it sounded maybe not as believable. I think we are,
A little bombastic, maybe, but
yes, I think we are now, like when I say it now, it does look a lot more within reach. I think in the next 5, 7 years, I believe that we are going to be there.
you know what? From your lips to God's ears. So I have a few questions for you, kind of like a lightning round. Um, if something comes to your mind, would love to hear it. Um, what's the first word that comes to mind when you think about this billion to one journey?
Uh, Maybe 2 words.
Okay.
Um, I would say um, innovation, because it
Mhm.
has always been about innovating in healthcare. And the second word would probably be um, is what would be a great word that represents that, you know,
How about culture?
a culture would be a great one. I think, we have a great
That's one thing I find that I've always felt is the kind of uh, execution culture, the accountability culture that your not just you but your entire team has is incredibly impressive.
Thank you. Thank you. I was going to say something along the lines of that, like almost like a persistence or not giving up or solving tenacity, solving
Yeah,
essentially any problem that you would face, because we have faced a lot of problems that, I'm very proud that our team has been able to execute really well through those.
yeah, tenacity. There's a in the cricketing parlance, there's a word that the Mumbai cricket players use. It's called kharus. It's kind of like, even against all odds, even if you're a lot of batters out, the last two guys will still stick it out and say, okay, we're not giving up. So I kind of resonate with that. Um, what's the one thing that you've learned about yourself as a founder, as a CEO? Because, I know also that during this journey, you've had to encounter some personal challenges also. Uh, and so, just any thought there?
Um, I I think I've learned that um, that anything is learnable.
Mm,
That I think um, the and that I think I've learned to really uh, respect many different points of view, especially as we approach it from a curiosity mindset and kind of combine them and do experiments to figure out what would work. Um, I think I've learned that I have a very high tolerance for pain. I can take a lot of pain when it is for a good purpose. um, and um, I think I've also learned that maybe uh, you know structure is very important. I think um, hiring the right people is critically important, but you also need to put them in the right structure for them to be
mm,
successful.
successful. Mhm. What's the best piece of advice you've received?
Hmm. I mean, I think the board telling me not to worry about COVID was probably the best advice that we
There
have.
was an interesting inflection point that didn't
Yes.
happen.
Yeah, it
You
was
know,
a very important advice.
great. What's the best piece of advice that you would give any young entrepreneur?
Um, I think approaching problems from first principles is very important because um, I guess it goes back to kind of that anything is learnable mindset. There was a lot of advice that I received from some of our really well-meaning executives that if you question, it turns out that it is not actually maybe fully accurate. So approaching things from first principles really helps you get to the bottom of the core assumptions that people have. And I think it allows you to really out execute your competitors and others. So you might not know something. I think being curious, asking questions, and kind of understanding the true reason behind how something is being done in a particular way is very important, right? And our executives will tell you, I do not accept that is how we have always done things as an acceptable answer to any questions, right? Like we need to understand from first principles, like why something is the way it is. And it might be that, it is structural and there are, rules and regulations and laws, it can be, there can be very good reasons for something that might not even make sense, but like approaching it from curiosity, understanding from first principles is very important because as a founder, you cannot know everything,
Everything.
but
Yeah.
you do need to learn everything.
Yeah. You know, here at Neotribe, we talk about, confident humility, confidence that you are no worse than anyone else, and humility that you're no better than anyone else.
Mhm,
And I think what I love about you and working with you over these last 6+ years is that you combine this confident humility with intellectual curiosity, right?
mhm,
Talking about asking questions. I also talk about, how the path to success is really knowing what you don't know.
mhm,
The most dangerous thing is not knowing what you don't know, because then you have a lot of hubris and say, how hard could this be?
mhm.
You know, um,
I
and
love that confident humility. It is a really great concept, I think. But how can I not have that though, right? Like I had, you know, I had professors who won breakthrough prizes and Nobel prizes, and they would essentially tell in front of an entire class that they were wrong and you were right when you suggested something. And you are just an undergrad, or maybe you
mm,
are a
mm,
PhD student, and they have no problem accepting that they are wrong and that their comment was maybe inaccurate, or
maybe they learned something.
and they learn something. And it's almost like that is the expected way to operate, right? If that is the right idea, and you were not accurate in the way that you were thinking about something, accepting that creates a level of psychological safety where the ideas thrive. And I think that has been a really core part of how we operate. And I never understood this. Sometimes people would come to me and say that, oh, you have a very academic culture. And I would say, what do you mean? Everything that we do is so practical, and we don't work on anything that is like, academic in nature. What they mean,
Theoretical.
I think, is essentially have that, academic mindset of like the ideas are the important things, not the people who, not the title of the person who is bringing that idea.
As we wrap up here, Oguzan, do you have any questions for me?
Well, maybe I would ask you the same question that you asked me to start this conversation. Um, you know, it is a leap of faith for you to, invest in BillionToOne. And I was, extremely impressed with the, how quickly you have learned, what we were doing, and you know, how well you were asking the right questions. And that is, asking the right questions is so important to me, as you can see with the way that we operate. And when I
Mm.
saw that you were, asking really smart questions, I was, incredibly impressed. But what made you, you know, decide to invest so quickly at that time when we only had a few hours that we spent together?
I am probably blessed with the same trait that you have, Oghuzhan, which is I'm also very intellectually curious and I love to learn. And you were a phenomenal teacher. You
Thank
still
you.
are. I think even if you're not started Billion to One, you would have probably made a phenomenal teacher at whichever university you chose to join. But those several hours we spent uh, where you were teaching and I was learning were just incredible experience of just learning as to how this was going to disrupt the status quo.
Mm.
And I also very quickly figured out that I was dealing with a pretty special person here,
Oh, thank you.
right? And in our business, I like to say it's knowing what you don't know, right? Because when you know what you don't know, three things can happen. One is you know what questions to ask, you know who to ask them off. Three is you know how to underwrite that risk,
Mhm.
right? And so I learned a lot from you from those days. I still learn a lot from you. And I hope along the way I have helped in your learning as well. But
Absolutely.
that was, in fact, some of my partners also marvel at this, like that you made. That was probably the fastest investment decision that I've made in my uh, 20-year history as a venture capitalist. And so one that I'm incredibly proud of and one that I'm privileged to be part of.
Thank you. Thank you for trusting me, believing in me. Uh, I
But
think
our work is unfinished.
it is
We
very
have
unfinished. We
several
have a lot of.
years more of work to do.
Yes, we do.
This is just the beginning.
It is just the beginning.
It's a new
Thanks so
beginning.
much. Thanks so much, Kittu.
Wonderful. Thank you so much, Oguzan, for this conversation.